Okay, this is female Foley catheterization remediation phase, remediation 3. I'm starting from the sterile field phase. I performed hand hygiene. Patient has been draped. They've been told what the process is going to be. And we're ready to start the sterile field and ready to start the catheterization. I have my kit. I'm going to pull it out. Sterile kit. I'm going to fasten my waist bag right here next at the patient's hips. I'm going to open my sterile kit and I'm going to grab my sterile gloves. Have my sterile gloves over here in a separate field, only touching the 1-inch border, which is now dirty. I'm going to take my left hand. I'm going to just pinch the cuff of my dominant hand glove and I'm going to put it on slowly. And then I'm going to push inside here on my off dominant and my off hand, and I'm going to pull it on. Now I have my gloves. I'm going to move my sterile field over here to give myself some room to work. I'm going to take my blue drape or my blue pad. I'm going to ask the patient to lift up their tips. Set the blue pad underneath. Patient says okay. I have my my drape. I'm going to place my drape over the patient's perineal area. I'm going to take my lube and set my kit. Lube up in my kit, have that ready to go. I'm going to take my syringe and I'm going to insert it so that is ready to go. I have my wipes. I'm going to clean coming outer inner or middle and then nearby. I'm going to take this hand. Now I'm going to spread the labia. Everything is clean. I'm going to hold this here. I'm going to take my sterile kit, my catheter. I'm going to properly lube it. I'm going to tell the patient to take a deep breath and to hold still for me while I do this procedure. Explain they may feel a little discomfort and to take deep breaths, but it'll be over soon. I'm holding it. I'm inserting 3 to 4 inches. I'm seeing some now I'm 3 to 4 inches in. I'm seeing some urine. It looks clean, no cloudiness, no blood, light straw color. Everything looks okay. I'm going to go in 2 inches deeper. 2 inches deeper. I'm now going to inflate my Foley. Okay. Foley's in. I'm still keeping the labia spread. Gonna put a little tug on it. Nothing's changed. It's holding still. I see urine coming. I have my bag. Discard my syringe. I have my bag. I'm going to hang it at the side of the bed on the frame rail. Not any movable parts, so it stays steady. I've got my leg a portion. I'm going to attach it to the patient's leg so it acts as a strain relief. I'm going to now release the labia. I'm going to take the drape. I'm going to clean any solution that might be remaining. Put that in my trash. I'm going to put the patient at a comfortable level where they're comfortable, and I'm going to explain how the strain relief needs to stay onto the leg so that it doesn't pull on the bag or make the bag fall out or come in. If they're going to get up and move, the bag needs to remain below the waist, below the level of the perineum, not above. They can't carry it above their waist. And if they're going to be in a wheelchair, to hang it on the frame of the wheelchair. Patient is comfortable. They agree. They're able to understand my instructions. And the procedure is complete. They're in a comfortable position. I see that urine is flowing. It's a good color. And I'm going to complete now my procedure. I thank the patient for everything, and I clean up my tools, and I go and document the procedure, even writing on the Foley bag the date and the person that installed the Foley. And that is it. Thank you.